Super excited that we have the Sultan of Sports Physiotherapy here with us again, Phil White. And what are you calling your business now, Phil?
Mate, Sultan. That's a new one. I like it. Yeah, I'm just going by my name because I did have ADPT physio earlier, which I'd started with someone else, and it just confused people, and it confused me. And now I'm just working under my own name, Phil White Physio, and yeah, simplified things and means that it also gives me the opportunity to sort of talk about things in a very like personal way and putting my own sort of spin on it rather than trying to have this like sports brand. It's just like here's how I apply this stuff to my own life and how it's helped me and how I help others. So yeah, it's been a fun switch.
Amazing. And you've got a good name too, Phil White. It
It's
has
one
a
of those
it
things where
has a
people
ring to
always
it.
like call me by my full name. Like there's yeah, so many people always just say like Phil White. It's like almost a one syllable Phil White.
Yeah.
anyway,
Well,
but
you're always gonna be Dr. Phil to us here at
there you
Unity
go.
Gym. That's
Nice.
how our tribe remember you. I want to talk to you. I want to get your opinion today on a couple of topics. And first of all, let's dig into the concept of uh, pain and the way our body, I guess, dishes out symptoms of pain, and also how we should perceive those symptoms of pain. And to put it in the context of a tribe member or a listener who's probably starting a new exercise program or potentially just a new physical activity altogether. It could be running, it could be gym, it could be UMS training. Uh, you know, what they should experience, and what's normal and what's healthy as far as sort of discomfort, pain goes, and at what point should they be concerned, whether
Yeah.
it goes beyond the desired, delayed onset muscle soreness after exercise, or starts to verge on an injury or an issue that may become problematic.
Yeah, for sure. I love the idea of like waking up, you have like no memory of what's come before. Maybe you just woken up from a coma or something and you try and go about your day. And then you go to like sit down in a chair or walk down some steps and then you have a burning like horrible tearing sensation in your quads, and then you're trying to stand up again, your legs are on fire, so you use your legs to stand up, and like that would just be the scariest, most horrible pain where you feel like your body is just like on fire and breaking. But then if you had that like the day or 2 days after a really hardcore squat workout, you'd be like, yeah, that like pain is exactly what I was looking for. Like the context of it just brings so much meaning to it and really matters. So I think that can be such a hard thing when starting out in exercise. So just understanding what pain is sort of expected, the time frames it's expected to come on. Like often the fact that delayed onset muscle soreness comes, not just the next day, but like 2 days later, and then it kicks out. Like, have I hurt myself here? Is this normal? Is this right? But yeah, I think pain is one of the most important things to understand, just in life generally, because yeah, it's so often misinterpreted. And I think the fact that there's such significant opioid addictions all around the world, and particularly in the US, like there's a lot of signal there that pain has been not treated very well and poorly understood from like a medical sense, but also from just like you know a person and their like life manual and how they approach things. So yeah, I think it's just such an important topic to chat about.
I watched this great movie on Netflix the other, maybe it was Netflix, I'm not sure. Pain. Uh, what was it called? There's a couple that have come out recently. This one was like called Pain, not Pain Junkies. Anyway, good movie. It has the dude who plays Captain America. Can't remember his name. And a great cast. And yeah, this it was all about this company that produces a pain medication for cancer patients that are really facing imminent death, and so they can dose them up pretty heavily. But then they start prescribing off-label to everyone and come up with the classic pain is pain, so we should be able to drug anyone who's
Right.
experiencing any sort of pain whatsoever. And of course, they run into all sorts of trouble, luckily, by doing so. But um, the reason I bring the conversation there is because this mantra of pain is really untrue in my reality. And I have experienced quite severe levels of back pain from a pretty bad fall, and that carried on for almost a decade. So I do know when people are looking at me, if there's anyone there watching me talk now and thinking you don't know what real pain is, trust me, I have experienced that before, and I definitely don't anymore. But that is very different to the type of pain experience that I have, or I will even rephrase it, reterm it to discomfort after exercise. Because, as I said offline to Phil prior to our conversation here, um, I actually it's a win for me at the end of the week. By training every single day throughout the week, and then even a boxing session on Saturday. By the end of the week, I am sore, man. Like everything hurts, and I sort of get to that point in the end of the week and go, ooh, like if it's good enough, if I feel in enough discomfort, then I'll treat myself to a remedial massage and things like that. But it's something that I actually aim for, and I consider it a win. But the very same experience to someone else who's new to exercise, who hasn't been exercising like this for decades, experiences that as a real threat and have a very different experience. Because our pain from and you can probably dive deeper into this. I'd like your take on it, but from my understanding, pain is about perceived threat. The brain in some instances. Is that
Yeah,
right?
no, definitely. Like that is kind of the explanation of what the purpose that that pain is playing in a human is that it's your brain trying to get signal from all parts of your body, and you don't have pain nerves. You have lots of different information receptors that then feed up that information from all parts of your body into your spinal cord, and that's modulated. The volume's turned up or turned down by your metabolic system. So in like a chronic inflammatory condition, your pain signal's the volume's gonna be turned right up. If you're in fight or flight mode where you've got adrenaline, coursing around your system, then that signal's going to be turned way down because it's a little paper cut is not going to be a big problem if you're running away from a tiger. So then at once that information reaches the brain, then it's your thoughts, moods, belief, and context that really inform the output that it is pain. So if you've listened to the podcast before, you've heard that spiel quite a few times. But I think just kind of understanding that, like, damage doesn't equal pain, and there's two levels, both systemic and then at your brain, where that information is being processed. Like, that's just so important to understand, because sometimes if you feel something really intense, you think, oh, intense pain, that must mean like intense damage, but it's not always linked like that. So uh, and yeah, when I said there with the brain, like if your thoughts, moods, and belief and context really impact your level of your pain, then having that context of like, this is expected, this is what I hoped for by training really hard, then that can really start to dial down the intensity. And even if it's still feeling intense, it then turns that pain from what would otherwise be like scary. And I like to differentiate between pain and suffering. So suffering being you're in pain and it's stopping you from doing what you love and it's affecting your outlook on life. Whereas objective pain that is understood and well controlled, it doesn't necessarily need to lead to anything bad. So that's how I like to think about it.
So, so for, on that, you mentioned there that there are metabolic factors and health factors that can affect the experience or the symptom of pain for someone. So, the exact same experience that I get after exercise and what I benchmark as a successful week of training in the body of someone who's less healthy. Are you saying that they would be experiencing a heightened state of pain symptom based on their general health?
Yeah, I mean, pain is obviously so subjective, but I think a really good way to understand that connection between the pain you experience when you're not metabolically well. Obviously, there's the fight or flight situation there with the adrenaline, but a one that is very close to home at the moment because my partner and my baby have been very sick with the flu. Is like when you get sick, that feeling where even just like wearing your clothes just hurts. Like every part of your skin is just like prickling and aching, and doing anything, any kind of contact just becomes so uncomfortable. It's not that you're suddenly getting damage from your shirt. It's just that the signal is turned up so much by that kind of physiological metabolic state you're in that all of that signal is just on overdrive, and you're experiencing every little bit of it. So it's it's very much influenced by what's happening at the systemic level before it hits the spinal cord, but then at your brain again, it's sort of recontext. The context is then changed again, and that can turn up or turn down. But just to clarify, it's not to say you can think your way out of it, but certainly if you can change if you can gain really good understanding of what that pain means and have a well informed and optimistic, or at least like rational understanding of it, instead of it being this confusing, scary thing, then that can really help experience it in a way that is no longer suffering. It's just an objective experience that you can sit outside of.
Man, there's a lot more about it than meets the eye. I have this theory that, and you can, I guess, either disprove it or support it, that this is one of the reasons why we should be training, especially my training is more strength training than cardiovascular training. I do a couple of runs and I walk a bit, which probably sounds pretty lame to you,
No,
but
any
but I one of the reasons why I train, and I love this. I love the quote by David Goggins. He says, one of the reasons why you train is to callous the mind. Essentially, the more physiological stress you put your body under, and so long as the body is adapting in a healthy way to that physiological stress, then the more you can experience without it pushing you over the edge and making you dislike it or feeling uncomfortable. So I guess what I'm trying to say in a better way is the more you adapt to physiological stress, the more you can handle. Would
Yeah, I
you
think there's
agree?
like two things there.
And then
There's
therefore,
sorry, there's
go
like
on.
I guess there's like the physiological adaptation element, but there's also then the mental side of things. And I think the like Goggins has been, such an interesting case of just really pushing for that, like callousing the mind particularly, and saying that you can just push through anything. And obviously with his stories of doing an ultra with no training and then ending up with shin splints and everything, like that's not going to be a great approach for for most people to take. But I think like the idea there of definitely like exposure therapy, I guess, to discomfort then familiarizes it. And when we're talking about pain as perceived threat, like when you're really familiar with something, it does become less threatening. So there's definitely really something in like mental resilience you get from training. But I'm not like, I was kind of worried when I did my first ultra earlier in the year that I'd go full Goggins and just want to punish myself with like crazy events and exercise. But fortunately, the takeaway was I just love running in the mountains and nature, and I want to do more of that. But just pushing past like physiological barriers for the sake of some arbitrary accomplishment doesn't really do it for me. But yeah, I think the callousing the mind is definitely, there's something in that. Just use it appropriately.
Yeah, of course. I mean, I would like to say, and if we can bring this back to the application of sort of strength training for our tribe who are doing the UMS, Rad reports often that people who start with us, who come what we would say compromised, they start because they're injured and they want to rehab an injury, and we try to how do I say it better? Unpigeonhole them. We don't want them to come in thinking that they've got this compromise and therefore they can only train in a
The
manner that's suitable
identity,
to that
my
compromise.
my favorite
Wh- wh-
concept is that the injury identity, which is something that I
yes,
um, you know,
perfect.
feel so much had felt so much myself, and I know you guys had it as well, where you felt like everything you did had to be dictated by your injury, but it should just be informed,
Absolutely. Yeah.
not dictated.
Absolutely. And that's what we try to address immediately. And we don't do it by saying, hey, drop the injury identity. Of course, that's never going to work. But
Yeah,
what we do is just try to get them to look at and approach their training from a macro perspective and say, listen, the best thing you can possibly do to overcome an injury. And let me just build some context first. A lot of these people are on the verge of going under the knife or something like that. And this is kind of like a last a resort attempt to have a go at healing or preparing for that possible surgery. And we just sort of say, look, the best possible thing you can do from a macro perspective is get yourself as strong and physically capable and able-bodied as possible, irrespective of whether you choose or opt to go under the knife in the future. It's going to benefit you. And in many cases, as someone's strength, and I certainly experienced this personally, and I know that Rad's experienced this personally, as your strength and mobility increases over time, your injury identity slowly just fades away. It disappears because you no longer, I don't know whether it's a physiological adaptation that's very tangible or whether it's a mental adaptation that's less tangible, but you become, hardened, you become more
yeah.
resilient
I,
in
I think
general.
I think understanding where identity comes from, and like it has a identity has is kind of like a shortcut that you can have to have certain beliefs, and then when you have certain beliefs, that's a shortcut for then taking actions. But it kind of works the other direction as well, where it's really hard to think your way out of an identity. But if you take certain actions and then those actions over time, if for example, here it'd be really practical. Like if you think you have a really bad back and therefore that's your, you have that injury identity. Your belief is deadlifts are bad for me and will hurt my back, and then therefore I don't do. My action is to not do deadlifts and only to ever do core activations and reformer Pilates. Love reformer Pilates, but this is just an example. But if you then take the action of
Do you
doing,
really love
I mean,
it?
it serves a really useful purpose for certain people in certain contexts. Like, and if your aim is muscular endurance and you like being in a class with other people and you like having lots of guidance and you enjoy it, then it's infinitely better than doing nothing. So, but for, and like, seeing it in the sports context, like the AFL guys did it when I was at the Giants in professional sports. Like there's an application there for the long hold stuff.
Really? The
Muscular
Giants
endurance and
did
yeah,
reformer Pilates.
yeah, like muscular endurance and stability work. You can do some really effective training there, but they did it in the context of also doing amazing strength conditioning in the gym and also doing
Yep.
amazing like cardio conditioning and as well. So, but where people go, I think a bit wrong is only ever doing the Pilates and not mixing it in with anything else. But that aside, so if we go back to that idea of identity, beliefs, and actions, so if we then sort of try and suspend your beliefs for a little while, show you how to do a deadlift with really good form, do it in a way that progresses the different variables of intensity, range of motion, volume, speed, complexity. If we sort of really simplify it, start nice and light, reduce the range, do it in a controlled way. And obviously, this is after making sure that you're safe to do it. If there's any back uh, reasons why we wouldn't do it, then obviously we'd test that first. But if you can, do a rack pull, which is basically a higher weight, sorry, a higher, like starting from your knees, for example, for a deadlift, doing it with a light weight, getting the movement, even starting with like a dowel rod and it doesn't hurt, then you think, okay, like I've taken that action and it hasn't hurt. So therefore, maybe I can try the next action, which is putting a bit more weight in it, increasing the range, increasing all of those variables over time and getting feedback from it. But then if you're then doing deadlifts like we're seeing Rich on screen, if you're on the video, if you're doing really good deadlifts and it's not hurting, and then you kind of end up realizing you're having fun and you sort of enjoy it, like that then starts to change your belief that deadlifts are bad and they're going to hurt myself. And if you start to realize like, hey, I can actually like, bend down and pick things up now without pain, whereas before I'd be too scared to do it. And then those beliefs then can start to change your identity. So um, that's where I think this becomes very actionable is just looking at like, okay, what is what are the beliefs that I have and are they true? Because so often we believe things, but they might not actually be true and they might not be serving you. So it's worth working with people who can challenge those. And if it is true, like if you do really have some structural change that means that just deadlifts aren't right for you, that's totally fine and valid, and that might change over time as well. So don't let your you know beliefs be permanent. Like retest these things if it is safe to do so. But yeah, being able to realize when beliefs are serving you and then being able to take the actions to change your mind is one of the most important skills I think you can have in life.
I had an anecdotal experience myself where my early experiences with physiotherapy after my horse riding accident were, I would say, I argue now that they were not helpful because I was sort of told a number of times by I was working with a chiropractor in Mossman at I won't name the names, and I also worked with a physiotherapist, and both of them at one or a number of occasions said you will never be able to deadlift and squat. It's not an exercise that's going to be good for you ever. It was a fairly blanket sort of statement, and I took that on board, and I formed a very strong injury identity that really freaked me out from those movements specifically. And that issue carried on. It would have been around the age of 18 that I was told that, and then in my early 20s, when I was working at Fitness First as a personal trainer, I started hanging out with other trainers who were heavily into the powerlifting. And I also went and did a couple of certifications with the late Charles Poliquin and Tony Battaji, and slowly started to warm to the idea of engaging with deadlifts and squats and barbell lifts, and It was a technique that I was pushed over the edge by Sebastian Oreb, our good our mutual friend, who sort of challenged this notion of being afraid of deadlifts and said, "Well, Charles has a very different approach where he actually gets you to do this extreme range of movement, which is the snatch grip deficit deadlift, which, if anyone who's playing at home who doesn't know, what that does is increase the range of movement. But what he does is he basically starts you on zero weight. This is a shot of Bass and us all on a podcast a while ago, and you can see the size difference in the two of us. He is a elite level power lifter, at least at his peak. Now, he challenged me to give it a go. He sort of said, "Well, what have you got to lose? Like, for the last 4 or 5 years, you've complained to no end that you can't do squats and deadlifts. You're still in as much pain as you were back then. You've tried everything. You haven't tried this. So what have you got to lose? Like, is it honestly going to get much worse?" And of course, that was my fear, that it could get worse. But I was, heavily compromised. And the smallest things you might be thinking, well, why bother? Why not just carry on with your life? Well, the problem was that the smallest thing in everyday life would trigger my back spasm, and I'd be laid up on the couch for a number of days, unable to move. Like, it was so painful, and I'd go and get a couple of times. I got, like, I rushed myself to hospital because it was so bad, and they would do a new MRI, and nothing had changed from a week ago or a month ago. So there was nothing getting worse I guess on a tissue standard, like there was nothing tearing, there was nothing breaking that they could pick up on a scan, and there wasn't even increased inflammation. It was really just a reaction of my body causing a severe muscle spasm. And anyone who's had a muscle spasm that lays you up, it is like
Yeah,
you
it's no joke.
can't. It's no
Yeah.
joke. It really, really, really hurts. Slightly off topic quickly, I'll jump back on. Did you watch the cricket the other day where the guy was dealing with muscle cramps when he was out there, the Aussie
I
guy?
I have never watched cricket in my life.
Oh, really? Oh,
No,
man, this
no.
poor guy got the best score in a one-day test history. He ended up getting a double century, and after about the first 100, he started cramping up, like,
Yeah.
really bad, and by the end of it, he was having his entire body up his erector spinae, hamstrings, glutes were going into spasm, and he was, like, limping down to try, and they ended
Oh,
up saying, "I can't run, so just stay on swing, and they only will score the fours and the sixes." And he ended up just annihilating it. They won the game. It was the most incredible thing, but he collapsed so many times, like, in full spasm. His body was
yeah,
just
the
gone.
best spasm I've seen was in when I worked for the Giants early on, and just for those playing at home, the Giants were a new AFL club in the professional league from in about 2012, and I started with them, and they'd gone for the approach of like get a whole bunch of 18-year-olds, the best ones in the country, and bring them up together instead of bringing in star players. So it meant that they were all just a bunch of kids getting absolutely smashed by grown adults and good teams. And I just remember this one defender who the defenders would get pretty worked because they would obviously be getting scored against constantly. And he came off the field, and I was doing some on-field massage down in Canberra, and his it looked like a scene from Alien where this like thing was trying to escape his calf. Like the muscles were just convulsing in the most like distressing way. Where like every different, there's three different muscles in the calf, and like all of them were in these like asynchronous contractions. It just looked so horrific, and I just had to. Stick an elbow in there. He took some pickle juice, which they use for cramps, and then he had to go back out there because it was all happening to all of them because they were so underprepared. Brutal.
Oh, man, look, so the reason I digress is that muscle spasms, it's no joke, and it can lay you up. Now, going back to my story, what happened was quite remarkable for me because I was terrified of deadlifting, and I just persevered with it, and I did the exact protocol that Charles had taught us in the PICP level 2 certification, strength training certification, which was when someone has a weak posterior chain, then you just really hammer it with volume, but you progress so gradually. And in most cases, you make such an astonishing regression in load. But much to, where we'll probably take this discussion, you really overload range. And the range of motion becomes the loading variable, not the intensity of the exercise, which, I'm sure we can dive into in another discussion. But it worked incredibly well for me, and I did that, and I now continue to use it as a protocol that I do probably a couple of times a year to bring up the strength in my posterior chain, and I've never had back problems again. Now, I do from time to time experience a back spasm, but now I really understand how to disassociate from that being a threat, and I will manage it accordingly. But strangely enough, now my protocol for overcoming a back spasm is to deadlift it out, meaning I go to the gym. As long as I can still walk, and it happens very rarely. It might happen once a year or twice a year. I go to the gym and I literally, like, I'll regress the intensity, meaning I lift a lot less weight than I would aim to do on a healthy workout, but I just go through the motions. And in my interpretation of what's going on here, and you can correct me if I'm wrong, is that I'm reinforcing to the brain that this is safe, that my body is okay, that the injury that I had sustained many years ago is done, it's rehabbed, it's over. I don't have to carry that identity anymore. Would you say that there's any truth in that?
Yeah, I mean, from like a big picture, like chronic pain standpoint, like I think that's the thing that does really have an impact on your experience over time. But I think in the acute setting of you're in a an acute bout of muscle spasm, I'm not sure if it works that quickly of like flicking the switch of pain off. I think there you're probably having more of a physiological effect on the muscle spasm itself and helping the muscle spasm because it does respond to warmth and loading and that type of thing. So there's probably a bit of that combination of both. But I think understanding what pain means and being able to know if something is an acute bout that of something that does need rest and loading, like rest and deloading. So if you've got a muscle tear, some acute cartilage damage, any like bleeding, inflammatory response to things, knowing, okay, this pain is really useful for telling me to back off here. And muscle spasms often are a good sign to, back off things. But for most people, I wouldn't encourage them to go and deadlift it out unless they're, you know, yourself who has so much experience in it. The best thing to do there is usually get some warmth on it, but certainly starting to load it up and keep moving as much as you can. But yeah, knowing when there's the kind of acute stage and what you can do in the acute moment to assist the pain, or just realize like, hey, this is fine, this is normal, I'll deal with it, and then having the understanding of like this sort of brain changing practice is more of like a dealing with chronic pain over time. So it's not just think your way out of pain in one moment. It's start to change those beliefs by giving yourself so much evidence from as I said before, with getting that guidance, doing repeated work, and giving your body a chance to unload. And with that, just to briefly touch on what you said with there with like overloading range of motion as the progressive variable there. If someone had a disc bulge injury, for example, or certain nerve injuries, that might be the most aggravating, worst thing you could possibly do to really piss them off. Whereas doing heavy rack pulls, nearly like whatever your maximal weight is, might be really quite comfortable and give you a really good response. And then gradually working through the range is then how you get like there over time, taking into account tissue healing times and what else is going in your life. So it is really important to realize that there's nuance there and there's a reason why getting professional guidance on this stuff is really important. Is to figure out like, okay, what structurally is involved, what do we know about that, and what are the variables that are going to piss off your injury, and how do we keep training, like keep your rehab feeling as much like training as possible by being as high on some of like the variables we can be, if that is what you want to do, and then reintroduce the aggravating ones over time.
And I think that I want to save this for a different discussion, because I know that we've gone for quite a while here, and I want to really dive deeper into the different variables that we can use to progressively overload, because I think that's a discussion in and of itself.
Mm.
But I want to just quickly finish up by bringing it back to how this would apply to someone who's started a new exercise program. So they might be a seasoned athlete in what they're used to and conditioned to, but they've started something new, whether that is UMS, CrossFit, powerlifting, strength training, whatever, and they're experiencing symptoms that remind them or have a direct, you know, link to a past injury that they have an identity with, that they're trying to fix or solve. What is the best course of action for this person who is experiencing some pain? It's not bad enough yet on the Richter scale to take them to your clinic, or get them in front of a
Which is
physiotherapist or
only
physical
online at
therapist.
the moment, just to clarify. So
That's
if you've
right.
got
Yeah, 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 yeah. You are an online
an
clinic
online guy.
serving the greater population. But how would they use this conversation? What would your advice be to that person? So they've started a program.
Yeah, yeah.
One of our members recently has had this exact back and forth with Rad, there to fix back pain. Or there to fix. We have people, a lot of people here to fix shoulder pain that they haven't been able to get, to overcome, and they're experiencing a little bit of, pain after a month or two of training, and my, I briefly spoke about this earlier offline. My father got told to exercise. He's got chronic back pain. The first workout that he did under the supervision of physio, he did physio, they call it physio size, I think, and it's at the hospital, very, very moderated and in a controlled environment with physiotherapists. And he experienced discomfort, I will call it. I don't know whether it's related to his injury, but essentially he felt worse after the first workout, so he never went back again. And I don't think that's a very good outcome. I don't think that's useful. And I think that so in my experience or opinion, you've got to, in some cases, experience a little bit of discomfort to overcome in the long term. What would you
Yeah,
suggest?
so many threads to go on there, but I want to first point out that I think that like obviously it's such a big motivator for people to get into exercise, and I see it happening, so often with particularly the UMS because it does attract people who think that that it's going to be the key to fixing their injury. I'm putting inverted comments there, and I totally, as someone who works in the rehab space, like obviously getting past an injury is like the best thing you can do to help yourself, but I think going in with the goal of fixing, again, inverted commas, your injury as the main criteria you're basing your training off just sets you up for such a hard time because then it makes it such a keen focus that every time you do anything, you're always zooming in mentally, putting the magnifying glass on the area and being like, are you sore? Are you sore? Like, did that hurt it? And then that can just mean that when we talk about that idea of turning the volume up and turning the volume down, like if your thought, mood, belief, and context of training is like, this is my last ditch effort, it needs to fix it, and then you zoom in on the area, that's going to turn up the signal that you're getting from there, and you're going to be so aware of any pain that's happening there. So, how practically the way I like to encourage people to go about it is like, I want to get back into training, and I want to see what I can do. I want to focus on all the stuff I can do, and then I would obviously want to adapt it so that it's appropriate for my back. But if the outcome of that is that my back pain is gone, great. But I'm going to focus all my intention on like all of the other progressions and improvements you can make. Because particularly if you haven't trained in a while, like you're going to get really good gains in so many other areas. And if you start to focus on those, it can really, again, change how much of your mental bandwidth, or I like to kind of visualize it with, if you've got a huge like computer monitor, if you're just thinking about the pain, it's like you have a maximized screen and all those other improvements you get in your life are just these little minimized things in your taskbar. But if you can start to look at those other factors and then start to make the box smaller and smaller of your focus on pain, like you will actually experience less of the symptoms. So again, that's not to say ignoring the pain. It's not to say like you know it's not a worthwhile thing to try and fix injuries. Obviously, that's like the main goal. But if we can do it in a way where it becomes rehab is training in the presence of injury instead of you're doing rehab and it's all or nothing to make this thing better, it just shifts um, the mindset, and that really can help make the experience enjoyable. And when you're having fun and you're seeing progress, that's when you stay engaged, and that'll have a really big effect on how you're actually feeling as well, pain wise.
I
So
love
that's
that. And I
step one.
love, yeah, I love that we've been able to circle back to this macro perspective of the best thing you can do is just make your whole body stronger, more physically able, and try to relinquish or give up this identity of you being in the naughty injury corner. And I love the saying, and I wish we should put on a t-shirt. Injury rehab is training in the presence of an injury. It's not
Yeah.
training differently to
Yeah.
everything else because you're
Yeah, there'll be
compromised.
some differences, but it's not a separate thing where you just like suck all the joy out of training. It's like you're trying to like optimize for joy and progression and like enjoyment of the process, and then doing it in a way that will help give the injury what it needs to recover in the best possible way. And yeah, like I posted something the other day about how like there's the like with getting into training, and someone put a with injury, and someone's like, oh yeah, but you're also exposing yourself to risk there. I'm like, yeah, but you're like all of the benefits you're getting uh, wouldn't be present if you're sitting on the couch, but you certainly would be getting plenty of downside and plenty of aches and pains from sitting on that couch the whole time as well. So I think it's just, obviously you want to do this in a sensible way that's guided by a professional if you don't already know what's going on. But there's like all of the side effects of exercise. If you're still in the same pain, but you're fitter, stronger, more flexible, whatever, like you're in a better
Yep.
place. So that's
Yeah.
really good.
Yeah. Yeah.
Um,
That's right.
in terms of like practical takeaways for how to know if what you're doing is appropriate pain versus not, I think like one is figure out if it's DOMS. If you don't know what DOMS is, like I'm sure most people would have experienced it at some point of that like muscle burning after an exercise, but often the day or the day after. But you said there about like a flare up of an old injury. So I think the best way to think about this is this term irritability, which I talked about on the podcast yonks ago. Yonk is a very Australian word there. Sorry about that. So ages ago.
Yeah. Means a while
So
back, a minute
yeah,
ago.
so irritability is basically how intense is the pain, how quickly does it come on, and how quickly does it settle down. And so those three things give you different information. And obviously, like don't try and figure this out necessarily on yourself. Like work with a physio and start to learn like what symptoms mean. If you're getting like nerve pain, shooting pain, numbness, all those kind of things, like obviously that means something different. But the how intense, how quickly it comes on, and how quickly it settles down are three things that you can quickly identify. And if you're getting something that is like intense pain, comes on real quick and lingers for a long time, obviously it's going to be pretty severe and pissed off. But often you'll get a sharp pain that'll come on instantly and then never turn up again, and it's not reproducible no matter what you try with that same stimulus. I'm less concerned about that. So intensity and like onset is often like kind of not that bad. But the one that I think is generally sensitive to something needing a bit more nursing is how long it lingers for. So if you're getting something that you've like tried something and it's quite painful, even if it's not that painful and it takes a little while to come on, but if you're like sore for days and that pain is really lingering and sensitive and it's reproducible when you try that same sort of stimulus, that's probably the most sensitive one to say like, okay, go figure out what's going on there, because either there's like if the injury is not healed yet from an acute injury perspective, or if you've got some sensitization of tissues from long-term chronic pain. And sensitization is again that like you've been so protective of the area that it's just not used to anything. So any information there is just like quite threatening. So those would be probably the takeaways there. But again, don't try and do irritability on your own. Like work with a professional if you're not sure about it. But hopefully that bit of a framework helps you guys figure out like what is going on there. Because sometimes you just think like, pain, it hurts. But if you can start to like really zoom in and like pick out the pieces of the pain and is it localized? Is it spreading? Is it, nerve pain? Is it, a burning, tearing, but like all of those things give us so much information. So if you can be aware of what's happening there, and if you start training and something's really not feeling right, then having that language to communicate it to your physio will make it so much more effective in diagnosis.
I really like that three-pronged approach. The severity, how quickly it comes on, and how quickly it goes away. And I do recall Rad bringing up a couple of case studies within our tribe where they spoke about the fact that it comes on after the workout in the area that they have been problematic, but it goes away after a day. And that to me would signal that that is something that they need to sort of just, keep an eye on, but work through in time, because it sounds like that is just maybe even a bit of a sort of,
There's a
I don't know.
sensitization there if it is a chronic thing. Like it's just that you haven't exposed yourself to that in a long time. You've probably got some of those metabolic factors that we talked about, which is turning it off. You've also got the threat of like, oh shit, this is like a new thing that I haven't done before, and these used to be scary exercises to me. And you've got the other thing we're talking about there with like, I'm coming in here to fix this back pain, and now I'm feeling symptoms. Like you've got all of
Yeah.
that there, which is changing your thoughts, moods, context, and belief. And you've got that physiological aspects of the having not trained in a while. Like it's a pretty perfect storm for feeling something. But again, just like your dad with that experience, like when you're getting into this stuff, like you're not always going to get it right. And it's especially when you're really new to exercise again, or you've been quite injured, like the threshold for adaptation is like the thing you need to overcome to get
Yep.
stronger and get fitter. But your buffer is super small. So if you go over that threshold by just a little bit too much, then you can aggravate the area, and that can obviously be really demoralizing for people. But I think you just got to treat it with like curiosity, and treat it with like a long term, hey, this is the rest of my life. Like I've got to just figure this out and get it right. So when I say curiosity there, it's like, okay, cool. That's like information that we've got now that something hurt there. So let's figure out like is, is it one of the variables? Is it just, the type of exercise? And just go back to it, because at the end of the day, like, the biggest, most important thing you can do for like longevity and health is exercise, and the easiest way to do that is to enjoy it. And one of the biggest things that impede enjoyment is pain and feeling like you're scared of doing stuff. So, like, just treat it with curiosity, work with professionals, and yeah, just keep at it. It's so important.
Yeah, I love it. I love it. I love it. And there's so much in there for our tribe and for anyone else listening. Pay attention, and hopefully you pay attention right to the end, because I think the key takeaway was right at the end there. Thank you very much, Phil. That was a great discussion,
Love
and
it.
opened up the door for so many more, which we will continue doing. So watch this space, everybody.
Yeah, would
We'll be
happily talk
back
about this all day.
soon.
And yeah, I'm really like, I'm writing about all this stuff, particularly like around how to enjoy exercise. And sometimes that is from fun and being doing with people, but sometimes that like enjoyment comes from getting really good progression, getting really good results. So there's so many factors to enjoyment, and that's kind of where my interest really lies here. Because if you can enjoy exercise, you don't need to rely on motivation and whipping yourself. Like, you'll do it because you want to do it. So uh, that's the topic that I'm most interested in exploring, and figuring this stuff out is all paths to get there.
And on that topic, where can the listeners find you, Phil?
Yeah, so at the
Where's
moment,
the
like,
best?
Twitter is my main area, like main place that I'm posting this stuff, but looking to expand out into other stuff soon. But at Phil White Physio on Twitter, or X, is where I'm posting most of my stuff.
Lovely. Lovely. Awesome, guys. Thank you very much for joining us. There will be links in the description. If you're watching on YouTube, please smash the like button. And if you like what you heard, then subscribe. There'll be more like this coming up with Phil. And if you're listening on the podcast, if you haven't already, give us a 5-star review. It goes a long way. You never know who that might put this great content in front of.
And just
For everyone else,
last plug for me is that yeah, while I do have a bit more time, I have opened up like on free online consultations, 15-minute discussions to sort of make a plan for you. So while I've got the time, I'm going to keep doing that. So if I've got really busy and you're listening to this month down the track, it's worth checking out my website, which is philwhite.me, and yeah, looking to book in a call. So
There
happy to
is
help.
there is nothing more powerful than expanding your artillery, arsenal, or inner circle with and adding someone like Phil to the mix of someone who you can bounce ideas off. Like, one of the most valuable things that Rad and I have ever experienced was having you and Nilesh work in the gym when we were all training together. It leveled us up immensely,
Yeah,
and
and
was a major
two-way
contributing
relationship, like,
factor.
yeah, I mean, I learned so much
Yeah,
from that. As you said, you like, your dad's seen physios, or you've seen physio in the past. And the thing is, most physios don't get the experience of training in like a strength conditioning context. So, and it's a very conservative industry. So a lot of physios will say, don't deadlift, don't do this, like, don't train in the gym, because they're just scared of it, because they've never experienced it themselves. And I've
yeah.
had the first-hand experience of training with you guys, learning from you guys, and our network, as well as having injuries and seeing what a fundamental difference training the way you guys do has had on my own life. So yeah, it's good stuff.
Amazing. Awesome.
See
All
you
right,
next time.
guys. Until next time.